Medicine X 2016 Ignite stage, speaking on the topic, Redesigning Maternity and Early Child Health Towards Integration and Better Value, please welcome to the stage Jody Lin and Victoria Wu. Welcome, ladies.
Isn't this child cute? From an evolutionary standpoint, we are programmed to gravitate towards children. But there is something really wrong about this picture. Can you tell me what?
How about this one? Pregnancy is an important time in people's lives, and it's often an opportunity for change.
And while having a child and being pregnant are interrelated, they are not viewed as such in healthcare. Moms and babies frequently travel to clinic visits together, so you would think that there's a tradition in medicine in which they're treated as a unit. But that is not the case, and it is having significant impacts on the health and economy of our society.
My name is Vicky Wu, and I'm an OBGYN.
And my name is Jody Lin, and I'm a pediatrician. And today, we'd like to speak with you about a major flaw in the healthcare system that's taking a significant toll on the US.
This is a delivery room. On the left, you can see a delivery bed where a woman labors and delivers her baby, and on the right is a warmer where pediatricians assess the baby. This physical separation is representative of the divide between women's health and pediatrics.
And it's not for a lack of resources. In fact, each year, over $200 billion are spent on pregnancy and early childhood health care. In spite of this, the United States scores poorly on maternal and child health indicators, including maternal mortality, prematurity, and infant mortality.
Evidence shows that early childhood is a key window of opportunity to affect someone's life trajectory, and this includes the prenatal period, since mom's health directly affects that of the baby.
We spent the last year at the Clinical Excellence Research Center here at Stanford creating new models to improve care for pregnancy and early childhood. Today, we'd like to share with you 3 solutions from our work.
The first is to risk stratify healthcare, which means to assess our patients and not just give them one-size-fits-all care. That means we assess both their medical risks as well as their psychosocial needs.
Examples of this would include telehealth visits for routine, low-risk care, such as a young, healthy pregnant woman with no additional social risk factors. Intensive care coordination for those facing lifelong chronic illness, and referral to social support networks for those facing social stressors.
We also propose screening for medical and social issues at visits. While it can seem daunting to try and screen for all these comprehensive issues in a 15-minute visit, we have good comprehensive screeners that patients could fill out prior to coming. Then we can address not just their medical issues, but other social issues like intimate partner violence or food insecurity, which will give them better care.
For example, a child with poor asthma control can receive as many albuterol and steroid treatments as they need, but addressing the issues in the neighborhood are critical for long-term asthma control. Supporting the mother to deal with the smog in the neighborhood and mold in the apartment complex are key measures in which we can ensure better health for the child and their mother.
Finally, we suggest screening for maternal health issues at pediatric visits. Oftentimes, maternal health issues are uncovered in pregnancy, but once the pregnancy is over and the baby's delivered, mothers lose contact with healthcare providers.
Pediatric visits occur at more frequent intervals, and this allows opportunities to screen for maternal needs that may affect the family, such as obesity, depression, birth spacing, and lack of consistent access to a healthcare provider.
We know that healthcare costs are ballooning with our aging population and chronic conditions, but we can help prevent those healthcare costs by averting the chronic conditions at the very beginning and addressing children's health and mother's health.
We can do better by bringing mothers and children together as much in healthcare as they are in life.
These solutions that we've shared with you are the best next steps to increase quality and decrease cost, and we can reinvest that saved money into our economy. Furthermore, mothers and babies want this care. It improves patient experience.
Our children are our future, and assuring their success is the most impactful innovation that we can provide as healthcare providers and society.
Integrating care decreases cost, increases value, and patients want it. So let's work together to take the best care of our mothers and babies with these innovative solutions. Thank you.
Good work, ladies. Man, you had like rehearsed that down to a T. They didn't even quite take the 5 minutes. Amazing. You should be really pleased with yourselves. Can I ask you a question? Because we've got a bit of time. The mortality rates, are they different in the US compared to other countries?
Yes. So this was
Yeah. Actually, come on stage. Unscripted question time here.
So compared to all other developed nations, the United States scores poorly across the board in all maternal and child health indicators. So we're not doing as well as other countries who are just as developed as we are in terms of supporting the health of our new families.
Yeah. And that's a really shocking statistic. Why is that the case? What is research pointing to?
Well, there's a lot of different factors that might be incorporated. One is a thought that we have a very large health disparities here in the US. So while we have amazing technology and a lot of money that goes into it, not all our moms get equal access to that care. Actually, the US ranks 48th in terms of maternal mortality if you look at the WHO scores. So we could be doing a lot better, and likely partially that has to do with poor access for some of our poorer populations compared to other countries that have a more equal access for all.
Because it strikes me, you watch television shows like, Outlander or things that are set, a couple of 100 years ago. And I always think, man, if I was to go back in time, what would I want? And painkillers and a toothbrush is usually quite high on my list. But you look at, in those old movies, or the movies that are set a few 100 years ago, like how difficult it would have been for women to give birth. And you would think that in 2016, then a country like the US wouldn't be rated 48th in the world. That's really shocking. Yeah, so you guys are going to fix this, aren't you?
We hope so.
Excellent. All right, we'll give you a round of applause for fixing this. Thank you very much.